Hi, if you're watching this, it's likely because you're coming up on your next phase of care in my office. And I really believe it's essential you fully understand what you're doing and why you're doing it when it comes to taking care of your spine and your nervous system. And, I talk to my patients, and, the vast majority of them, they can remember why they first started getting adjusted, but, over the course of time, what happens, whether it's months or years, it's easy for the priority of health to slowly slip and then take a backseat to work or life or family or finances and things that come up. And really, if your quality of life depends on your quality of health, then you have to know what health really is. And when you first started care, we taught you, and we talked about this, about what health really is. And if you remember, what the real definition of health is, is it just looking good? Is it just feeling good? The vast majority of people, when you ask them what is health, that's what they'll tell you. Yet you and I both know someone who looked good, felt good, and still got sick, whether it's heart disease or cancer, and they didn't actually feel the problems developing. So the true definition of health has nothing to do with how you feel. In fact, for you to feel a symptom, you've already lost 40% function in that area or that tissue, and then you feel the problem. And then what are we taught to do once we feel the problem? A lot of people run to the medicine cabinet, run to the doctor, take a medication, cover up the symptom of the problem, not respecting the body's innate intelligence, not respecting the fact that that symptom was actually a warning sign or a problem that your body was geared to tell you that, hey, there's a problem here, do something about it the right way. And really, if that model of health was working, taking a pill and covering up symptoms, we'd be the healthiest country on the planet, but it's not. When you rank all the countries, we rank dead last when it comes to health. So we're the sickest of the sickest, and dead last in nearly every single category. So if I don't teach you anything else as a patient of mine, if you hear nothing else from me or remember anything else that I say, remember this. If the only thing that I teach you is to abandon that system of thinking and living for you and your family for the rest of your life, that's great. And that right there is going to save your life. So when it comes down to it, for you to be healthy, if your goal by being here is to be the best version of yourself, you have to know what health is and then what actually controls health. And so health, when it comes down to it, health is the optimal functioning and healing inside of your body. It's the optimal function. So your body's ability to function and heal at its absolute best. And what system in your body actually controls optimal functioning and healing? It's your nervous system. Really? So the reason why you're here, the reason why you get adjusted is to make sure that your spine and nervous system is functioning at the absolute best. If you put your hand on your heart right now, you're going to feel heart beating. You don't have to think about that right now. Right now, your lungs are breathing. You don't have to think about that right now. Your stomach is digesting, producing enzymes. There's 100 trillion cells inside of you. Each and every single one of those cells perform about 100 different chemical reactions. So the greatest doctor in the world lives right inside of you. There's no better intelligence. You add up all the supercomputers in the world, and it still wouldn't be able to operate the human body even for a second. So the best doctor lives right inside of you. That doctor needs no help, just no interference. So the goal really should be for all of us is find the cause, remove the interference, let the body function at its absolute best. That's the role of your spine, by the way, is actually to protect that system from being damaged and being interfered with. And so the real function of the spine is actually for protection. But what happens, and remember, the spine should be straight, should have nice curves from the side, but what happens throughout life, slips, falls, injuries, accidents, poor posture, stresses of life, even toxicity and trauma. Some of the worst spines that I see on a regular basis are those who have been exposed to toxicity over a period of time. And when you look at your x-rays, what you really want to see is good proper alignment, and you want to see things moving in the right direction over time. That's why we take x-rays on a regular basis to make sure if this is going in the right way or the wrong way, and how do we course correct. So when we go through your x-rays, we have to decide, what's your next step, because there really should always be a next step. And I have some patients who go from maintenance back into more of an intensive phase of care for a month or two because they're under increased mental, physical, or emotional stresses of life, or maybe it's a combination of all three. Many go from 2 to 3 times per week down to once per week. The research shows when you are in phases of degeneration or arthritis, the bones continue to degenerate between 10 and 14 days of not being adjusted. And so that's why the recommendations don't usually go beyond once a week or once every other week, unless you've been properly taking care of your spine and nervous system since you were a kid and you aren't in any phases of degeneration. So when we talked about your, maybe you talk to your friends and family and you try to talk to them about chiropractic, there is sometimes this stigma that once you get adjusted, they just want you to keep coming back for the rest of your life. If you've ever talked to somebody and they said that, maybe you've heard that before. Anything done for your health or wellness really should be done for a lifetime, by the way. And if you run into a friend who you haven't seen in a while and maybe they've lost a bunch of weight and you say, "Man, you look incredible, you look great, what have you been doing?" And they say something like, "I started eating right, I started exercising almost every single day." There's no way you would ever say to them, "Did you know that you're now going to have to keep up with that lifestyle for the rest of your life if you want to keep and maintain that weight?" It's just not going to happen. And chiropractic is no different. And now, I do want to say this, just because you started getting adjusted, that doesn't mean that now you're going to have to keep doing it for the rest of your life. That's your choice. Just like brushing your teeth, it's a choice, but it's my job to tell you that it's the right one. So that's going to look different for everyone. Depending on your lifestyle, depending on your home care, depending on your phases of degeneration and what your spine looks like. It's not 3 times a week forever, that changes. But I say this, that everyone should be under regular chiropractic care from birth to death or for as long as you want to be healthy. Frequency is going to change throughout. So, when we review your x-rays and we go back, I'm obviously going to give you my best recommendations for your spine and your nervous system. And, I get adjusted at once a week. I think that's a good lifestyle recommendation for most adults. My wife, my sister, my staff, my doctors all get adjusted at least once a week for just general health and wellness and mobility and movement of the spine. Some are coming off of 2 times a week for a while and they're not ready for one time a week yet, so they stay at twice a week for some time. Some are okay at once every other week. It's $40 an adjustment regardless, so 1 time a week you can do the math. And that's, let's say it's $175 with exams and everything. And really, who pays for that? You do. It's delusional thinking to believe that insurance is responsible for your health and well-being when they actually tell you up front in Medicare's guidelines, it says we don't cover services that seek to prevent disease, promote health, or enhance one's quality of life. All the other companies follow Medicare's guidelines, so they tell you up front it's on you. But if you believe your insurance is different, we can give you a super bill and you could submit it to them for any type of reimbursement and fight that fight. But from my experience, hardly ever works. But I believe at the end of the day that health is yours. So as a lifetime chiropractic patient, we work really hard to drive down our costs to make it doable for whole families to be under maintenance level care. And what's incredible is that as your family lives this life, as your family rarely gets sick and they rarely have health issues and health complaints, and when your family is the vibrant family full of energy and full of life and looking younger and feeling better and feeling healthy, not on medications, not adding them with time like most people are going to start to notice and they're going to start asking you questions about what you're doing and why you're doing it. And really, your family is going to be the definition of health in their life. And when they start to ask you these questions, don't be shy. Speak up. It's okay if it's not normal. Normal's not cool when it comes to health in America. You want to be different because that means you're living outside of the norm of sickness and drug and disease and surgeries. And your family, they're living and walking in purpose because ultimately you have your health.